regrets.
I'm going to read what Jency had. Good morning, Board of Supervisors, and thank you, Supervisor Chavez, for bringing up Agenda 10. My name is Jency. I am representing custody health nurses. Right now, we nurses have no nurse-patient ratio. One nurse is assigned to take care of between 100 to 150 patients. And I'll add that's in Main Jail. At Elmwood, they have about 300 patients per nurse. Patients in 8 hours, they take care of between 100 and 150 patients in 8 hours. If one person ends up in jail, that doesn't mean that they don't deserve high quality care. They are human just like us. They deserve high quality medical care just like everybody else. Right now, our staffing is barely covered by travel nurses, overtime, and double time nurses. We are working double shifts 6 to 7 days in each pay period. Not that we nurses want to work that much, but we feel very bad for our coworkers struggling in the unit to cover the assignment. We forcefully prepare our mind and body to support the unit. I am requesting all of you to vote yes on Agenda 10 to establish safe nurse-to-patient ratios so that we can provide high-quality care for our patients at the jail. And then I just want to say that, thank you, Supervisor Chavez and Supervisor Ellenberg and Supervisor Cortese. You guys have really listened to us, and I feel confident. I'm not going to mention 24/7 MD coverage, the janitorial positions that are needed, and the safe medication administration, and the non-English speaking, because I've talked about it for a year.
Good afternoon, supervisors. My name is Alan Kamara. I'm one of the vice president for RMPA. I would like to take this opportunity first and foremost to thank Supervisor Ellenberg for your visit to the hospital. Thank you so much for coming around and visiting with our nurses. Dr. Smith, I also want to thank you for coming to visit with our nurses as well. I know I'd already thanked Supervisor Cindy for doing that. Thank you all. Needless to say, I think we've been here for the past maybe 2 or 3 years. I want to take this opportunity to say, I was able to witness one of the public speaking of Supervisor Samedian, where he says persistency always yield result. I think our nurses were frustrated. They came here several times expressing frustration about the custody health staffing issue, patient safety, the relationship between them and the officers, the sheriff. This recommendation, Supervisor Cindy, I want to thank you on behalf of all our nurses. Thank you so much for listening to us and give us the opportunity to address this issue. Whatever the result, you made a statement, and that to tell us that, I do listen to you guys. Sometimes we come here, we don't even think you all listen to us. We do, because we felt like our concerns have been, we've cried and cried several times here. But today, this is a good step forward. We want to thank you. We want to thank the rest of the board. Please, we encourage you to vote to pass this. On behalf of all the nurses, thank you again.
Thank you.
Speakers who came out and waited for so long, and RNPA in particular, and Angela, the work that you've done just to get my attention, well done. Okay, so colleagues, this is a two-part referral relating to custody health services staffing and medical care standards in county jails. As it relates to staffing, at the December 12th, 2017 board meeting, I brought forward a referral asking for a jail staffing study, including custody health services. My understanding is that the jail staffing studies that's currently in progress is being conducted by a consulting firm procured by the Office of the County Executive, and the administration did not include a staffing analysis of custody health services as part of that study. This referral is asking the administration to conduct a staffing study of custody health services as it relates to the work both in the main jail and Elmwood. It also requests that the board receives a concrete proposal and timelines at the January the second meeting in January, whatever that is, not the 14th, which is what I'd originally put in this, but staff has asked for it to come back at the second meeting. For conducting and completing this study in time for the fiscal year 2021 budget discussions in May. My intent is to ensure timely and efficient provision of medical and behavioral health care services in the jail and enhance safety for staff and detainees. The second part of the referral requested administration report back to the board also in January with a timeline and recommendations relative to addressing concerns brought forward by the custody health nurses and RNPA over the last year. Their main concerns have been the lack of 24/7 physician coverage, the lack of janitors in the infirmary, and problems with administering medication to severely mentally ill detainees, as well as delays in the procurement of dual language headset lines in booking and clinics and an interactive laptop with sign language for communicating with deaf detainees. That is my request, and I would just ask for my colleagues' support. And I'm
Thank
happy
you
to
very
answer
much.
questions.
We'll ask the clerk to please display the voting panel so that Supervisor Chavez may make her motion on the screen.
President Smitty.
And we have a second from Supervisor Wasserman. And now I'm going to Supervisor Ellenberg.
Thank you. I am going to support this referral. I think it's important. But if you wouldn't mind, Supervisor Chavez, there are 3 additional requests that I'd like the study to respond to. First, I'd like the report to break down the current makeup of staff and distinguish the number of FTEs, extra help, and contract positions. Second, I'd like information on pay differentials for all custody health, clinical, and support positions, including maintenance workers, janitors. And finally, I'd like information on how the staff manage the transition of inmate care as they exit our facility, particularly a detail on the staffing levels as they relate to care coordination with outside medical and mental health services. Does that work with your motion?
Yes, the one thing that I would just ask is that so first of all, those are great additions, so thank you. On the inmate care coordination, what I might do is, if you don't mind, I'm going to add that as a third component of the body of research that they need to do. And the reason for that is that Reentry has been working on that, and there's some report, I just can't remember where it is in process, so I'd like to, if it's ready and available, I'd like to bring it discreetly. It wouldn't have to be connected to the other
Thank you very
items.
much.
Thank you.
Anything else, colleagues? If not, we'll ask all 5 members to please vote on the screen. All votes have been cast. We'll ask the clerk to please tally the results and display the number. Thank you. We have 5 yes votes. The motion carries unanimously. That takes us to item number